This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Olli Tikkanen.
Welcome everyone. I am very excited about this episode as we are going to be talking about resistance training, its health benefits, how it could be better presented in exercise guidelines, and something called organelle recycling. Our guest holds Ph.D. in exercise physiology and is currently working as associate professor in University of Jyväskylä in Finland. His main research interests are muscle hypertrophy, atrophy, metabolism, and signaling. In addition, he is interested in sport nutrition and weight loss. Ladies and gentlemen, I'm honored to introduce our guest, Dr. Juha Hulmi. Welcome, Juha. So you have been doing studies about skeletal muscle and resistance training in relation to health and disease. Could you tell more about these studies?
So my main background is physiology, and I come from that background, but at the same time I'm interested in the health aspects of exercise as well. And maybe I will start with the studies of the importance of skeletal muscle first, because those have been quite recent studies. So as I explained, in those experimental cancer models in mice, those studies of ours suggest that there is some importance of muscle mass and maintaining muscle mass during cancer. So it may be important to for instance, for the patients, I mean, this is a speculation because these causal studies haven't been conducted in humans yet, but it may be true that this decreased muscle mass during many diseases and injuries and so on, it may be that it would be a good idea to try to maintain muscle mass as well as easily possible by exercise or some future drugs that, for instance, we have been investigating. And obviously, this can be then regarded as health effect. At the same time, the function as well, like how well you move and so on, they can be also considered health in my opinion. I mean, what's your level of performance? So if you think those are health effects, those kind of things we have been studying a lot. So effects of resistance training on the function of performance, and then the body composition, what happens to muscle and fat and so on. And then also we have studied metabolomics, for instance, what happens to metabolite levels in blood if you do resistance training and so on. So we have done those kind of things, and also the muscle quality. So my PhD student Jaakko Hentilä has been conducting studies related to the muscle quality after resistance training in younger and older individuals. So autophagy related phenomena, for instance, like whether muscle can recycle those, or has a capacity perhaps to recycle some of the organelles or proteins that have been sort of like damaged more easily or after this kind of resistance training program, meaning that resistance exercise could improve the quality of muscle, for instance, in a bit older individuals, if they can recycle their muscles a bit better. So we have done studies related to those, and it seems that there may be some beneficial effects of training on those kind of things. And then obviously in the literature there are lots of studies showing the effects of resistance training on cardiovascular health. So like we have shown some effects on non-HDL cholesterol of resistance exercise. So those levels of lipoproteins other than HDL can go down. Maybe HDL itself can go up. Total cholesterol can decrease, and triglycerides can decrease. And related to the function of exercise, so we have found, and others, that you can clearly do conduct exercise more easily after training. So sort of demands to physical activity are decreased. So you have to progress to make exercise as demanding as it was before the training. Then blood pressure can decrease after this training, and many other things, like as we have shown, and others, visceral fat can decrease after resistance training if you eat properly at the same time. Some markers of systemic inflammation can decrease, and many other things have been shown, many other benefits. So I think this clearly shows that combination of resistance type of exercise and aerobic type of exercise, and probably also some other physical activity, and like a combination of various sports is a good idea for health as well, not just for the function and enjoy of the exercise.
Yeah, it all makes sense. And when you talked about muscle quality and changes in muscle quality, could you elaborate more, like what do you mean with the muscle quality?
Yeah, so obviously there are many things that you could measure from muscle. So you could measure what happens to like if you do aerobic exercise, it would be important to measure mitochondrial function and amount of capillaries and those kind of things. Those make the quality of muscle in that regards better. But for muscle force production, then you could measure the content of myofibrillar proteins, for instance, versus other proteins. This is something that in one of our next studies we try to study what happens to those and how those changes are perhaps maintained and so on. So there are some recent studies showing that or suggesting that the way you train, like resistance train, may affect on the way muscle is growing. So it's just not all the muscle growth is the same. So the qualitative changes in muscle may be different if you do like if the intensity is very high or the volume is very high, for instance. So there may be some differences in that. So adaptation may be different, maybe perhaps even closer to the aerobic continuum if you do more like aerobic type of resistance training. But then for the quality that you perhaps mentioned was this capacity to recycle or correct problems in muscles if there are some, for instance, after aging or in some other situations. So meaning that whether muscle could be then capable of recycling damaged organelles or damaged proteins or misfolded proteins, or aggregated proteins, meaning that those proteins are just not functional. Whether this kind of capacity is improved after exercise or resistance exercise, and as I said, we have some evidence in humans that we have found that some of those changes are taking place. So, for instance, acutely after first exercise bout, when you haven't been doing resistance training yet, there is a sort of chaos happening in muscle in that situation if you do heavy exercise. So you have to really recycle some of the stuff, some of the unwanted stuff after this exercise. So then this kind of a process called unfolded protein response is activated, making it possible that we are not synthesizing non-functional proteins to our muscles. So this is probably important. And on the other hand, this autophagy recycling phenomenon is probably important. So exercise is activating this phenomenon in which we are recycling these organelles and also perhaps some proteins, and after exercise, acute exercise, and perhaps also after training more efficiently. So this may be important to maintain the quality of the muscle.
Yeah, this recycling of organelles is a new thing for me. I haven't read about it. So could you tell more about how does it work, and is it different when you do the first trainings or when you are experienced with strength training?
Yeah, well, the problem is that these phenomena are really difficult to, or even impossible to study directly in humans. So we just measure some of the markers that predict activation of unfolded protein response, or this autophagy. So this autophagy is interesting physiological phenomenon. It was awarded, or this Japanese biologist won Nobel Prize in Medicine, actually 2016, for finding this process called autophagy. So this is something that is really active area of research. And the problem is that in humans we can just study these markers of those things. So we can just predict whether these processes are taking place after single bout of exercise, and then after longer training period. But our results by Jaakko Hentilä and us in a couple of study settings suggest that then after acute exercise bout, this unfolded protein response is increasing, but this is not increasing anymore after the longer term training. So there is not like longer term changes similarly as after these first bouts, when there is a chaos happening in muscle because you are first time using your molecular engine as heavy as it happens. So there is some chaos happening, and then you have to really, or muscles have to correct some of the things that are happening. So it's different. And then for the autophagy, which is recycling of those contents, not just proteins but other things as well, then that's even more difficult to study in humans or directly in humans. But our study suggests that this phenomenon also increases, at least in young muscles, acutely after exercise bout, quite delayed though, like let's say 2 days after exercise bout. It seems that this may be increasing based on the markers we have investigated. And then after training, this capacity may still be raised. So there may be more of these autophagosomes after training, which may mean that when you continue training, you have more capacity to recycle those non-functional parts of muscle fibers, and that may be helpful in some situations. So that's just a speculation, but it seems that exercise may have same kind of effects as caloric restriction. so on muscle at least. So caloric restriction is also increasing and improving capacity to recycle with these processes. So that's quite interesting, and I hope that there will be more animal studies in this for these physiological processes, because in animals you can study these processes directly. This kind of recycling, it's just not possible in humans with the ethical standards that we have.
Yeah. So that's interesting that this has won the Nobel Prize in 2016. So it's quite a new thing. How do you see the practical relevance of this recycling of organelles and autophagy?
Yeah, there is some evidence suggesting that it really is important in many tissues, not just for muscle mass, not just for muscle. So people are speculating that some health effects through caloric restriction, as you probably know, those studies. So those health effects may come at least in part through activation of autophagy. So it may be important for our tissues to maintain this capacity to recycle and improve. And that's probably important. And for muscles, there are some studies suggesting that some beneficial effects of exercise on muscle, like glucose intake into the muscle fibers, and also some effects of exercise or muscle related drugs on muscle quality may be affecting on the performance of muscle through autophagy. So it may be important for performance aspect or qualitative aspect of muscle function as well. So if these processes are not working properly, it's perhaps possible to increase muscle mass without getting it really functionally strong or more efficient to conduct its functions.
This podcast is sponsored by Fibion, a research device that has been shown to be valid in tracking sitting, standing, physical activity and energy expenditure. Furthermore, Fibion has been shown to be valid categorizing physical activity into light, moderate and vigorous intensity. In addition to scientific accuracy, Fibion provides automatically produced and easy-to-understand reports for research participants. Get scientific validation and learn more about Fibion at fibion.com/research. Fibion, from researchers to researchers.
And if I go a little bit back, you mentioned about continuum between aerobic exercise and resistance training. That's an interesting idea that it's a continuum. Could you tell more about your ideas of this continuum?
Yeah, the problem with science in a way has been that quite often, at least in medical field, people don't understand what exercise means, and they don't understand what aerobic exercise means, and they don't understand what resistance exercise means, and then they don't understand how many types of ways to train there are. So, for instance, if you look at the recent recommendations for exercise in worldwide recommendations, there are only usually few words or few pages of how to conduct resistance training and important concepts in there. And I find it really frustrating for exercise scientists that in the medical field, I have been working in the medical field quite a lot, but there hasn't been enough us exercise scientists doing collaboration with people in the medical field, so that the field could understand really this continuum of training. So basically, you can have muscle strengthening component and even increasing this hypertrophy component even in aerobic training. For instance, if you do cycling, for instance, you do uphill cycling, you can really produce stimuli for your legs that can produce hypertrophy if you eat enough. And the same thing happens with the resistance training, that if you understand the physiology of exercise and the coaching aspects of exercise, then you can understand that if the exercise is certain, the response can be totally different depending on how you conduct the exercise. So for instance, if you do this kind of resistance exercise in which you will have do explosive jumps, for instance, with your own body weight or just some kilos of weight, the response is of this exercise, which is still called resistance exercise. If you really produce force, you should call it resistance exercise or strength training. If you conduct it that way, the response is totally different if you compare it to this strength endurance type of exercise, in which you have, if you are doing, let's say, 30 to 50 reps, you will have long rest periods and so on. So I find it really frustrating that this physiology of exercise is almost totally forgotten usually, and people are just trying to simplify too much. I mean, I understand really for the recommendations that you have to simplify, and that's totally fine. But still, I think that the physiologists and coaching field of exercise have been forgotten here, because there is so much different aspects in exercise. If you don't understand those, you don't get the benefits I was explaining about resistance training, for instance. If you just go to the gym, you will be low responder for sure, almost for sure, if you don't know what you are doing. So I think our field should emphasize its importance more and more. So for instance, this continuum of aerobic and resistance training types of adaptations, it's important to understand. So it's clearly possible to have these cardiovascular health outcomes from resistance training if the resistance training is conducted in a manner that stresses your cardiovascular system. So understanding this physiology is important. But then if you do, let's say, more explosive type of exercises with very long rest periods, if you understand physiology, then you understand that you are not really stressing. You don't have any stimuli for cardiovascular health. It should be easy to understand based on physiology. So I think it's important to understand those things.
I fully see your point. So how do you think the exercise recommendations should be improved?
Yeah, well, I clearly am not an expert of recommendations of exercise for sort of a normal individual. So I come more from these exercise and sport fields. And I think that the recent recommendations are pretty good. So I like this idea of combining these aerobic exercise and physical activity to muscle strengthening activities. So I like those things, and I like also the idea that physiology is a bit better taken into account now, because studies show that you can combine these effects from doing quite short bouts or many short bouts or little less long bouts. You can combine these things, and you may get same physiological response. But what I don't like in these recommendations in worldwide recommendations of exercise is that this resistance exercise recommendation is so superficial. So for instance, in these American recommendations, there is probably more words of Tai Chi. You know well Tai Chi because you have been in China. I have even tried Tai Chi, but there is more of those kind of things, Tai Chi and yoga and so on, than resistance training. And I don't mean that it's a good idea to include those Tai Chi and yoga and those kind of things in the recommendation as well. But then there should be more this kind of information about resistance training. So if you just explain it in few words, it's it's quite difficult to get the benefits that you want, because it totally depends how you conduct the exercise. So you can conduct it and you have to understand also the goal of doing those. So if you want to improve the power of muscle contraction, which may be important in the elderly, you cannot just improve that by going to the gym and then doing really slow type of exercise, so for instance. So that is something that should be improved in the future somehow, to improve or explain better, and then also somehow advertising that there are experts for exercise who can be then used if you want to really optimize the adaptation from training. So that's something that I'm really interested nowadays, and how to decrease the amount of low responders of exercise. And this is something that I try to investigate in the future. So how to really get the benefits of exercise that you want, and what those benefits are at the physiological and molecular level. So yeah, I probably shouldn't talk more of those, because I'm just applying funding for studies related to that.
All right, don't release any information that you don't want. So you mentioned about, for example, power type of training for the elderly or speed. What other kind of aspects should be mentioned in the recommendations about resistance training?
In my opinion, in the future, if you just mention that, let's say 2 times a week, for instance, in the recommendation, and perhaps amount of sets, that's better than nothing. That's probably quite a good, because I understand that the recommendations have to be really simple and doable and so on. But then I think there should be, and now I'm talking especially of the American recommendations, because they are really intensive in a way, because there are tens of pages of recommendations basically, and information. So if you have this large amount of information about exercise recommendations, then I think there could be much more information about resistance training and the continuum of it. So how can you, if you really need to maintain muscle mass in the elderly, how should you do that? What's the evidence? How to improve power and speed, which is something that is usually totally forgotten, because it's it's forgotten also in many other aspects as well, usually. So the speed is something that we forget quite often. the fastest is the one who is winning usually. So we still forget that. So I think recommendations related to that would be important somehow. So for people to understand how that is done, so that training is not making you slower. And then also for strength, it's important to understand some of the effects, and then these basic knowledge related to progression, specificity, perhaps some variation of training, importance of recovery, and so on. Those kind of things should be emphasized so that people can understand how this, if they really want to improve not just health but function, how it can be done. So just few sentences informing those kind of things would be, evidence-based. It would be a good idea. And also, I think this concept of optimizing and maximizing could be important, and also how, if you want to do just the minimal level of exercise, what could be the minimal level, and also the level of exercise that could be too much. So they could be, in my opinion, those could be in the future good idea to incorporate somehow, because at the same time we know that some people are going to be non-responders or low responders at least to exercise on some measures. There are some who are doing it too much, and so basically physiology and coaching related things, it would be really nice to have those. So basic recommendations can stay pretty much the same. I don't mean that, but maybe then, to have some attachments or explaining those better. That would be my advice.
It makes all the sense to me. And you mentioned this minimum dose and too much. I think that I always find it interesting with exercise recommendations that where do you put the line? Because, for example, with many training, it's more you do, more benefits you gain. Of course, there's somewhere there is too much, but I find this minimum dose quite interesting. Could you tell about more? What would be the minimum dose in relation to resistance exercise?
Yeah. So minimal dose for average person for getting some of the cardiovascular benefits for aerobic training and those kind of benefits. There is quite good data to show that how much you could or should perhaps do exercise. There are some data for that. That's fine. I don't mean that there should be more. And but the problem even in that is that not all the participants are probably getting the benefits from this amount of exercise, because exercise progression and other things are important. Other variables are important to understand. So almost all of the recommendations are based on averages. So average response, sort of like a minimal amount of exercise needed to get some average response, let's say like 150 or 300 minutes of exercise. You get, on average, you get in studies, you get statistically significant benefits. But then there are lots of studies showing that in some individuals this is not enough to get almost any benefits, because perhaps their normal physical activity levels or the work they are doing, or I don't know, some other reasons make it so that you don't get the benefits if you don't do it heavier or more often, or even less for some if you do it too much. And for resistance training, the same seems to be true in a way, but for resistance training, I would say that it's a bit easier in a way, because for aerobic training, there is so much of this similar types of physical activity in normal life as well. So they clearly interact. So you can be really physically active in your daily life, and that's why you don't get so much health benefits from exercise, like this kind of exercise that we think how exercise is. I mean, like not just doing some voluntary activities at home and so on. But then for resistance training, we do less of those things in our normal life. Of course, we carry some weights sometimes, and we are climbing sometimes, and doing some of those things. But I think it's a bit more clear, maybe to give some recommendations for resistance training in that sense, because in normal life we don't do so much of those things. We do, but not so much. And the evidence pretty much supports the recommendations of resistance training in USA and in Finland, for instance. So this about 2 times per week is probably enough for most of the individuals to get benefits, or at least maintaining the physical function and health by resistance training. So studies pretty clearly show that if you do it once or twice per week, you can get some of those benefits on average. But clearly, those studies, individual studies that have been investigating at individual levels, then not all the individuals will get benefits from this type of training. And this is important to understand. Another thing that is important to understand is that if you want to improve your strength, endurance, or hypertrophy, or power, speed, decrease falls, for instance, if you want to improve your stability and those kind of things, then there are different ways to train those, and I think those are forgotten quite often as well. So those things are quite difficult then in the resistance training recommendations. So basic things are easy to understand, but then what kind of training? So for instance, if you look at the recommendations of Finnish resistance training or Finnish resistance training recommendations by UKK Institute, as I said, the main recommendations are good, and I pretty much agree that the evidence is pretty good towards those. And but then if resistance training is stair climbing and doing some heavy outdoor work, doing some group exercise, yoga, dance, are like considered resistance training similarly as training at the gym, then I think it's a bit confusing. So in the future, as I said, it would be nice to specify. So it's possible for some that dance is really resistance training, but I would like to see what kind of dance. So what kind of dance is resistance training. So yeah, so that's my long answer to something that you probably didn't even ask.
I think I even asked that, so I think it was good.
This podcast is sponsored by Fibion.
My name is Dr. Paul Batman, and I'd like to just say a few words about Fibion. I've used it a number of times on different projects that I've been involved in, and find that it's incredibly reliable, very valid, and incredibly sturdy. I love the graphics that come with it. It really is very clear and can easily see the active in and active periods as well. So I'd certainly recommend Fibion to anyone that's interested in finding out more about sedentary behaviour, particularly the concept of sitting and how we can possibly break it up with some really good, valid information.
So do you think, like, if I go back to the Continuum, do you think it should be promoted more as a continuum from aerobic to muscle strengthening, or whatever name you give it, or how could we convey the message, keeping it simple but still kind of giving these different aspects, that there's also much harder resistance training which will give more benefits than, for example, dance for muscle strength?
I think this UKK Institute those figures that they give are pretty nice. So they have this kind of a continuum. So they have, I don't know if you know the pyramid that they have. So they have this from sleep to flexibility or something. So these pyramids are pretty nice. I think they are trying to give this kind of a message from this low physical activity or even resting from that to this heavy. So that's quite nice way to show that. So I like it. So maybe just even specifying that also in some way of resistance training figure, showing that, and then how it's even more combined to this. It could be combined to this endurance training. So maybe somehow, I don't know, but it's these are just illustrative things. Even though I like drawing and illustrations, I don't know how to do that, but that's a good idea to even make it better. I like it already, but then to have it to do that, even to include that there a bit better still, that would be nice.
Yeah. And how do you see in future? Do you think we need to do the training, or will there be a magic pill that we can just take and not do the training at all?
Yeah. So the quick answer is it's probably not ever possible to make a pill that would do all those things, like to treat blood pressure and decrease risk for cardiovascular decrease and metabolic syndrome and increase physical activity, physical capacity, body composition, and so on. There are so many things that you can get from exercise, and also the enjoy of exercise, psychological benefits of exercise that you can get. So I don't find it possible. So the only way you can really do that is to get some kind of a pill and then take it with you to the gym or wherever you do the exercise and just put it into your pocket, and then that's how you get probably the benefit out of it.
Yeah, that makes all the sense. Yeah, so we could start wrapping up. Maybe before we finish, you are doing clearly important and relevant work. What kind of collaborators could take your work to the next level? Who could be ideal collaborator for your projects?
Yeah, I have been thinking many types of collaborators. So clearly this field of exercise health and exercise recommendations and that kind of field, how to really study those individuals who are not like us, who do exercise really like voluntarily or who quite easily get some benefits out of exercise. So some people from those fields, and obviously my background is more in the resistance training, although we have done some aerobic training studies as well. So I'm for sure I need collaborators in the field of physical activity and aerobic training in my future studies, for sure, because my knowledge is not that good in those areas for sure than in resistance training, and also how to measure these activity levels and so on. So those things for sure. And then in the field of psychology, probably I need how to get those people to move. If I want to study these variables, dose of exercise, for instance, then it's important to really get the participants to have the correct dose that we think would be good. And then also from the medical field and biomedicine, obviously I need collaboration in the future, similarly as I have done so far, and even more perhaps, to just have these state-of-the-art techniques to measure molecules from our body, and also to do some more mechanistic studies to understand mechanisms, and also from the medical field to get a chance to conduct these types of exercise. So we have been trying to figure out those things, and in our city Jyväskylä we have a really good chance to do those studies in the future. So I'm really positive about those studies. So not just conducting studies with athletes, but also with those people who would probably get benefits from exercise, but they don't just do it properly yet.
Yeah, so if any of the listeners are interested in collaboration, being in contact with Juha, so there would be interest with many fields to collaborate with. So we have had quite a long talk. It was very nice to have you as a guest and really interesting things. What would be your final remarks for this very interesting episode?
Well, I have tried to advertise the importance of physiology, research of exercise, because if we understand better how exercise affects and what happens in our body during exercise, then it's easier to also conduct these exercise studies and also to program exercise for humans. So that's something that I think we should and I should advertise even more in the future. So physiology of exercise, understanding that, and of course biomechanics as well. So those things are important in the future, and how to combine those with other fields of science and also to practice. So those things I would like to point out, and then of course the joy of exercise. So I hope I can play some beach volley today, just for fun, actually.
Hopefully it doesn't rain here where I am. It looks cloudy, but hopefully you get to play the beach volley today. Thank you, Juha.
Thanks, Olli.
Thanks for joining us this week on Physical Activity Researcher Podcast. If you like the show, make sure you never miss an episode by subscribing or following the show on Twitter. This podcast is made possible by listeners like you. Thank you for your support. If you found value in the show, we would really appreciate a rating on Apple Podcast or whichever app you're using. Or if you would, in a real old school way, simply tell a friend about the show. It would be a great help for us. We have a fantastic lineup of guests for forthcoming episodes, so be sure to tune in. Thank you all for your support and have a great day.